this side has been really hurting really bad, and
Okay.
it's made this
And
goes numb. And
Oh, the
it-
arm's going numb.
and it burns, and so
Okay.
this whole right hand side has been really bad
Okay.
the last
Okay.
couple of days at least.
Does it come into any particular fingers?
This side mostly,
Okay.
but it's a whole hand. But it starts like on my right
It
thumb,
starts here and then spreads.
most all of it
Okay.
is affected.
All right, so the first thing that we're going to look at is the line of the pelvis and the length of the legs. And it is your right side. So what I am seeing here is your pelvis is off, pelvic imbalance. And so your pelvis is rotated like this. So we're going to bring that back around for you. And then that's confirmed here. We have a short leg on this right side. So as this hip is rotated backwards, the femur sits in right here. And so it will give the appearance of a short leg on that side of rotation in its posterior.
Overwork.
She's been overworking. April's going to school to be a chef.
Yeah.
And working full time.
I think maybe I picked up something that might have been too heavy the other day too.
Okay. Where did you feel the pain when you did that?
What? In my low back.
Did you feel it in
right
that SI
in there.
joint?
Yeah.
Or more up in the spine?
Right in
Just
there.
right where.
Just like more like pressure instead of pain at that
Okay.
time.
Okay.
So I wasn't sure if it caused it, but now it's just gotten to where it's so uncomfortable.
Okay.
Afterwards.
So there is rotation in that. So see how this will go? I don't know if this will pick up on camera, but the body doesn't resist me. And then I come this way and her body pushes back. Can you feel that?
I can feel
Yeah.
it for sure.
Yeah, so we do have something going on in there. So if you can imagine that this rotates backward, and so then the body's going to have to compensate for that to bring the spine back to central, because you're probably not going to walk crooked, so the body's going to try to bring you back to central. And so that's what we're seeing here is that in this rotation here. And you can also see that her body's really holding itself. Basically this entire from here up is higher.
You can see it.
You can see that here in 3-dimensional. So we'll see how that comes out on film. So if you can imagine, this is how the spine is. And we talk about a bulging disc, a herniated disc, and how it puts pressure on the nerve. So if you would come close for me. So this is the spinal cord here, going down through the central canal of the vertebral space, and then off of that you have these nerves coming off. And so the nerve's gonna, like in this case in the lumbar spine, it'll end up going down the leg.
I was trying to get it better.
So this will end up coming out and going down the leg and innervating down into this leg. And so I want to show you what happens with the bulging disc. As the pressure grows, that disc is going to bulge out, and you can see that it's actually putting pressure onto that nerve. So you can see right there, that's what we're talking about when we're talking bulging disc, herniated disc, and how that affects the nerve. It's called the nerve root coming off of the spinal cord. So I wanted to get to show you guys that. Because this is rotated posterior on this side, we are bringing this ilium this way. And so the way I like to do that in my office is I use a drop table. So you're going to notice that the table goes up just a little bit, and then I'll show you how it drops if you want to kind of film that. It drops just a little. Basically what we're doing is we're using physics to our advantage. So you're going to feel right here, I'm going to catch the posterior aspect of this ilium, and we're going in a line of drive this way because that's the plane of that joint. So you'll see me here, push, and we do a few of those. Are you doing okay, April? Now we also have a triangle shaped bone here. And so what has happened is as this rotates backward, the triangle is going to have to come with it. It's called the sacrum. So what I'm going to do now is I'm going just a little bit more internal, getting on this lateral edge of the sacrum, and we're going to take that sacrum back down and make it match up with our ilium the way that we've moved that. I'm going to come down here and check leg length, and we're going to look at the horizon of that pelvis and see if we're making changes. So at this point, the pelvis is even, the legs are even. I am going to come over and move this other ilium. What we've done is this has come posterior, so we've moved this forward, and then we've brought the sacrum, the triangle shaped bone, to meet it. So what would happen if this is backwards is this has probably come forward. So I'm going to set this ilium this way, and then we're going to check, and that should be the end of the pelvic realignment, okay? So now this ilium, I grab it, and I'm going this way. Excellent. And then we're going to recheck. Good. What I'm seeing now that I am assessing things to kind of be done with this pelvis is I'm seeing that this femur is actually just a little bit high in comparison to this one. So I look here at the actual femur, and I can see that I still need to bring this femoral head down just a little bit anterior here. I'm looking for this bony protuberance on the femur, so I grab that with this aspect of my hand right here. It kind of settles in there, and we're just taking that anterior. Good. And then we'll check. One more of those. And pelvis looks great at this point. So what we're going to do on the lumbar spine is we're going to use the activator treatment. It just delivers, if you want to come a little bit close, it just delivers a little punch. So you can see here the rubber tip. I don't know if camera can pick that up, but it's just delivering a very quick thrust. So we're going to go in here where she had that rotation in that lumbar, and we're going to help that come around. And what you can notice is that I changed my perspective on the activator from here to here, because in this position, I'm noticing that this bone has kind of wedged like this. So I want this to come this way and up, and I want this to go down. So we can kind of create some movement in the line that the vertebrae has gone, not just in rotation, but actually in wedging as well. So if it's rotated this way, I can come straight. But if it's rotated and wedged, I can come straight and up. Doing okay, April?
Yes, ma'am.
This is a real common area on ladies in particular, because we have a chest, and so our chest is pulling us forward, and so that aspect of our body is always having to fight to bring us backward. So in women in particular, around this bra line area, we do always see a little bit of discomfort for them. So I do like to always focus in the bra line area. What I will actually be not filming today, but what I will be suggesting to April at this point, we probably need to get her in for a massage, because she has such a global situation with how her body's feeling at this point. Massage therapy is a huge help to the chiropractor in being able to address not just the bones, but the soft tissue that's creating some of the misalignments and movements in the bones. We're moving on up to thoracic. Okay, the next thing we're going to do is her thoracic spine. I do like to use manual care on April for her thoracic spine. Manual care is when the chiropractor is using our hands to create adjustments, and what a lot of you guys like is that popping sound. So I am going to have Brooke come closer so that maybe you guys can catch the crack. Although we may not get much out of her because she's so sore. Breathe in and blow. One more. This one. Man, you need a massage bad, sugar. Once we get up into these, the way the vertebrae are aligning with the So the ribs are going to come around and articulate with the spine here at the transverse processes. So the way that I address this is I actually come up above them. I find what I'm looking for, and again I'm using this little place right here on my hands to hook this little bony protuberance of the transverse process of the vertebrae. So I'm coming down. Here's my little spot. I'm going to go here, and then we're going to tip the head sideways to create some traction, but the adjustment is actually in the shoulder here. It's not part of the cervical adjustment. So she's going to stay relaxed. Her shoulders relaxed. Oh man, get over. Just relax. You doing okay?
Yes, sir.
All right, you on me? Okay, so all of this muscle needs to be worked out. We're going to grab that, relax that head. Shoulder is loose. One more. Got a little baby pop. Good. You doing okay?
Yes, ma'am.
I'm going to go back for this side again. Now we are going to work on April's cervical spine. One of the things, if you can notice here on the film, you can kind of see that April has a lot of muscle tightness. I don't know if you can pick that up, but there's a lot of muscular tightness through here. So one of the things that we'll be doing in massage when I get her back in here later this week is we're going to go through here. So we would start at the origin of the muscle, and we would come all the way down, 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 down into the insertion point. So we're not going to do a whole lot of that today, but I am going to do just a little so I can hopefully get this adjustment to move for me. So you'll see the pressure. You'll see April grimacing. And then we're going to rotate back out this way.
It's one of those things that hurts so good.
Lots of pressure. Let me know if it's too deep, April.
So far, so good.
Good. Now we're going to go actually up here. This is the sternocleidomastoid. It's the muscle. If you look in the mirror and you kind of turn your head and flex, you'll see the one that kind of runs diagonal across you. So it starts up here, kind of just behind the jaw. So I'm going to go right here, take my tissue pull. It's the same motion, but now I'm going anterior. You have to be a little careful in this one because you are starting to get up into some of that throat and vascular tissue. So we kind of go easy on this one, but it is one that gets spastic a lot. This one for sure in a whiplash victim would be something that we would absolutely address. Excellent. Okay, another one that I know on April that gets tight is right here above the clavicle. So the lay term for that is the collarbone. So here at the bottom of the neck and the collarbone, you can press in there. You guys can even push on this yourselves, and you might find that this is really tight muscle in here. So that's a way that you can help your neck relax, is by coming in here and getting these muscles just at the bottom of the cervical spine and dig just right in here above that collarbone. Real tender right there.
Ticklish a little bit.
A little ticklish? Okay, I'm tickling her. That's almost better than hurting her.
Yeah.
The other thing that I like to let you guys know is that you have lymphatic all through here. So something that is really just an easy thing for your body to do, sometimes when you feel like your neck is tight and stiff, you could flush your lymphatic system so that you're not pooling edema up in here. So what you can do in the shower when you're soapy is just come in here and rub real deep, and it might be tender. If it's tender, that means you were full. It was time to flush. So you just come in here and you rub, rub, rub. The other place to rub is going to be here in the axilla. Lay term is the armpit. So as you can see, I'm coming up, digging in,
Tickling again.
and then we're going deep.
It still tickles.
Does it still tickle? I'm like, maybe if I go deep enough, she won't tickle. So these are the couple places that you guys can go flush your lymphatic system, okay?
Makes me make funny faces.
It's pretty intense. April's one of my tough girls. She can handle this muscle work when I'm real deep in here. What I'm actually working on here, it's called myofascial release. So you're not just working muscle tissue, but we're going through that active range of motion, and we're releasing the fascia that exists between the skin and the muscle. So if you've ever cut up some chicken and there's that thin little membrane between the skin and the muscle, this active range of motion is something that we're able to facilitate, helping that as well as the muscle tissue. Research is showing that the fascia is very much involved in the body function, and it is another layer of nervous system is what we're kind of noticing, that the fascia is a global thing, and it is a very fast reactive communication system for the body to know exactly what's going on throughout its system at all times. That side's worse. Oh. You doing okay?
Yes, I am.
All right. Now what I'm doing here is you're going to notice, I don't know how well the camera can feel or view this, but I'm feeling for these transverse processes and where I have some rotation and fixation, meaning it's stuck. So this one in particular, I'm sure April would agree, is stuck. And then we get up here, and this is kind of her one that's always out on her, way up to high here. And this one likes to come up and wrap around and give you a headache. So this one in particular is something we definitely want to work on. This lower one is probably what's taking part in going down the arm and causing some of that, as well as the peripheral entrapment that we're going to address in the elbow. Here we're looking for that vertebrae I just found a moment ago. And there it is right there. So we're going to take this body into rotation. We're looking to lock the joint out, and that's where the adjustment is just beyond the lock of the joint. So you can see it rotate, and it wants to stop here. That's the adjustment. We're going to go in one more time. Here's your pillow. Excellent. Here we're on the right side. This is where she's got the one that's way up high here, that's going up into her head. So we're going to go find that one more time. Here's the vertebrae. I'm going to set up on that. So I find it, mark it with my thumb, and then I'm going to tissue pull, and then we put that body into rotation. So you're going to be able to observe that now. The rotation, and then the thrust on this particular is going toward the opposite eye. One more. If you guys are trying to do this for someone at home, obviously not the adjustment, but this relaxation, you're kind of taking your fingers underneath the neck, and it's up and pull, so that you're using this part of your hands as you come up and pull, up and pull. And then you just go segment by segment, up, and then back down, and work your way back up. And that traction can really go a long way if you're trying to help a loved one at home, just until you can get to the chiropractor. But please do not try to adjust someone. Let us do that. we're going to talk about peripheral nerve entrapment, which means it's not here at the center where the spine is, but rather something in the peripheral body that is entrapping, meaning putting pressure on a nerve that could be causing a symptom. So in particular, when someone's having symptoms in their arm, into their hand, the numbness, tingling, burning, those are all nerve related. And so what we've done is we've addressed here in the cervical spine, we've flushed the lymphatic system out. And now the other thing that we're going to go do, because in April's work, she has to do this motion. And that is the motion that gets all of this real tight. And we have a lot of system that runs through here, nervous system that runs through here. So we're going to go relax that so it can flow through there nicely. So because the motion is this, that is the active range of motion that we're going to take April through as we work into this muscle. So she's going to rotate this way. I'm going to take my tissue pull here, and then she's rotating round, and extension. Okay? So we do that a few times. How's the pressure?
Oh, it's wonderful.
I can feel it grinding around in there. You have a lot of stuff in there.
Yeah, there's one little spot in particular that gets like, I can't even bump it right there.
Mm-hmm. Will you let me know if I'm too deep?
No, you're good. So that spot that I'm telling you that I can feel where, like, right there,
Yes.
is that where the...
Yep.
You called it an entrapment. What is entrapped? What is it that is entrapped?
That's a great question.
Okay.
That's a great question. So once we're done with this, we're going to go over and use the posters so that I can show you the muscles we're working on and the nerves, the way that they're coming down the spine, so you can understand in a more visual perspective
Okay.
what that means.
Okay.
All right, you're going rotation up
Okay.
and over and extend. And up. Last one, this one. This is going to be horrible. Oh, you're so good. You're so good. She did it.
So you think about facing that, right?
So now we have all these muscles that are going to come down here. And so we're going to go work these. These are just coming straight up and down. So that's what we work them. So extend back and then flex forward. Okay? So extend back, flex forward. Extend back, flex forward. Extend back, flex forward. This one is really bad too. And back and forward. You see that muscle jump away from me? It's like a little kid running away from punishment.
Yeah, I feel it running from me.
There, I stayed on it. Good. Okay, we're going to go lateral. Let's come.
Okay.
So you're
Back this way?
mm-hmm.
Okay.
And down. These are easier. This isn't going to be as bad.
Yeah.
Not anywhere near, right?
Right.
Okay, now relax. Because her whole hand is going numb, we're going to do another thing. We have our carpal tunnel. Probably I think everyone at this point is used to hearing carpal tunnel syndrome. So what we have is we have a band right here that holds all these little bones together. And so that creates a tunnel through which all of the all of the nervous system runs through. So it can tighten up. It's a retinaculum, which is like a tendinous material. So it would almost feel like a cloth if you were to feel a cloth and kind of pull that. It's not built like a muscle, it's built like a tendon or even ligamentous really. So what we're gonna do is I'm gonna take her and go like this. And so what I'm doing is I'm bringing all this together and I'm pulling it apart. And I'm pulling it apart. So you can see how I take her hand here. I'm hooking in here and I'm pulling apart. Pulling apart. While I pull, I'll be taking her into extension. And so that's going to help open that tunnel. Even getting some pops in there already. in there.
Yeah.
Now, this muscle right here I can feel is really tight. This is the thenar muscle, runs the thumb. And so I'm gonna hook it and pull it, hook it and pull it. At the same time, it's going into extension. So we're gonna flex it forward, hook it and pull it. Hook it and pull it. Last one. Good. Now what I'm going to do is I'm going to take this thumb and we're going to pull it. And just open up this thumb joint a little. Okay. That's game for today. Basically, we're looking at these muscles right here. And so all of this musculature right through here is what's getting tight, and the nerve is flowing, running under there along with this. And so the entrapment, meaning the pressure, is created by this tight muscle here. And then down here you can see this retinaculum, the wristband that I was talking about. Here it is over here. So this is the front side, palm side. This is the back side. It goes like a wristband all the way around. You can see all the things that need to travel through that. And that's just, all you're seeing here is tendons. You're not even seeing all the nerves and blood supply that needs to run through. Let's jump over to the nerve chart. So now you can see how the nerves come out of the neck. They're going to branch and come down, 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 all the way down and innervate the hand. So where we're looking for entrapment, we worked here, and then we came down and we worked in here to release how these nerves are going to be flowing through that retinaculum, that wristband. We're giving them more room to come down and work through. And then going back up to the neck, this is what chiropractors work on mostly, is we're working on these nerves as they're exiting the spine, and they're going to go down, down, down and do what they need to do. And so if they're entrapped by a bone that's not working right, or by a muscle, or by both, you can imagine what kind of mess you're going to have, not just here, but all the way down the line. So that's what we're working on, is just making sure that those nerves are able to do their job. This video is dedicated to Matthew in Upland, California. Thank you so much for being a subscriber. I hope you all have a great day.